All right, everybody, so let's talk blood vessels. When you're looking at basic blood flow, you're going to go from the heart, out an artery, to a capillary, and back through a vein. And now as we start to kind of learn the names of all of those things, on the plus side, usually the artery names and the veins names match. So once you have the arteries down, you've got pretty much most of it down, because all you have to know is if it's an artery, if it's got that peachish color, the red color, the thing that's blue next to it, same name, you just change it to a vein. Direction of flow is different. The vessels themselves, like arteries, are a little bit bigger, veins a little bit flatter, but overall, that's kind of the pattern. So in this video, we're just going to work on the arteries, and then hopefully you'll feel a little bit more comfortable with those veins as you start to go through them. And the best way to do it, just draw it all out. Know how things relate to each other. Know where you're going to go next. So if we're going with arteries, we're going away from the heart. We're talking systemic circuit on this one. So we're going to go from the heart and then out. So basically, I drew everything out because trying to draw it on myself on the whiteboard gets a little tricky. So I'm going to follow my own hand motions here, but you have the image on your side. That side, this is weird, over there. So we'll start with the heart. So you're going to go from the heart out the aorta. So as you go out the aorta, you're going to go up. As you go up, that's the ascending aorta. You hit the arch. So we call it the arch because that's a great name for it. And then you're going to go descending. So with the descending aorta, you can distinguish where you're at depending on if you're above the diaphragm. So if you're above the diaphragm, we'll call that the thoracic aorta. If you're below the diaphragm, that's going to be your abdominal aorta. Now, off of the aortic arch, that's where you're going to see your first three branchings. The first branch, so remember if the heart sits slightly to the left, the first branch needs to take you over to the right side. And then you can split to go head and arm. So you're going over here with a little connector piece. We call that the brachiocephalic trunk. Brachial for arm, so you're going to be able to split towards arm. Cephalic for head, because then you're going to be able to split to head. So that brachiocephalic trunk will split into a subclavian going under the clavicle and then up towards the head through the common carotid. Whenever you see a common, that means you're going to split. You're going to split into an external, staying on the outside, and then you're going to go internal. So internal is going to supply blood to the brain. You're going to do that also on the left side, but you can go straight up the neck from the aortic arch. So the aorta serves as your connector piece for delivering to the head and arm. So you do not need a brachiocephalic on the left side because the aorta is doing that job. So from the left, common carotid, again, will split into an external and an internal. And then you also go through the subclavian. So as you're going under the clavicle, we're using that term subclavian. A lot of the vessels tell you where you're located. Once you get past the clavicle, though, you have to change the name. So now we're going to be in the armpit. Once you're in the armpit, we're going to call it axillary because that's the name of the armpit area. Then after we go past the axillary region, we're in the brachial region. So we're going to call it a brachial artery. Then as you work your way into the forearm, you name it for which side you're on. So if you're going thumb side, that's going to be the radial. If you're going to go pinky side, that's the ulnar, because that's where those bones are. So we have a radial artery, and then we have an ulnar artery. And that's the same on both sides. So you'll go on the left, you'll go subclavian, axillary, brachial. And then depending on which side you go to, you'll go radial or ulnar. So again, it's all about just knowing how these things relate. And if you can map it all out, you have a pretty good understanding of where these things are located in the body. Now let's go below the diaphragm. So as you go below the diaphragm, you're going to have some things branching off of that abdominal aorta in the same order. So from the celiac trunk, your three branches. You're going to go off that celiac trunk. You'll either go this way, and so you'll go up a little bit, and that's where your stomach is. So you'll have a left gastric. There is a right gastric. You're just not learning it from me in this class. At some point, you might learn it. So we'll have a left gastric. Then over here, down below that a little bit more, it's going to be a splenic. So we have a splenic artery. And then we're going to go over to the liver, that's a hepatic. So celiac trunk has those three branches for those three major organs. Hepatic meaning liver, so we'll go liver. Then we have gastric for stomach, and then we have splenic for spleen. So that's the function of that celiac trunk. Under the celiac trunk, you're going to have a superior mesenteric. The mesentery are the intestines. So you're going to go to that mesentery from the top with the superior mesenteric. There is one all the way at the bottom, that's the inferior mesenteric, but there are some branches that happen in between those two. So after the superior mesenteric, you're going to have your renals. Those go out to the kidneys, and gonadals, which will go down to the gonads, depending on the gender. So that could be testes or ovaries, depending on if you're talking male or female. Now, at the bottom of the aorta, you're going to have a split. And so these are going to be where you're going to first see a common again. So you have a common iliac. So we're at the ilium. So if you're by the ilium bone, you'll have an iliac Then you're going to split. Because remember, if we have a split after a common, you'll have an external. So the external is going to go out, and you have an internal. The internal stays in the pelvic cavity. So that's going to go for like urinary bladder. And then the external is going to actually exit out of the pelvic floor, and then it's going to come in front of the thigh. And so we're going to, again, name things for the region. So you're no longer by the ilium, you're going to be in the femoral region. So we have a femoral artery. That femoral artery is going to start to go behind the legs. We're going to go in the back of the knee, which is called the popliteal region. So the popliteal region has a popliteal artery. From the popliteal artery, you'll go posterior tibial, you'll be behind the tibia. Off of the posterior tibial, you'll have a branch for the fibular artery. That's going to go over the side. So that's on the fibula. And then on the anterior side, you have an anterior tibial, and then that's going to supply blood to the front of the leg. So hopefully it was helpful to see it all mapped out. And again, now you know most of the veins as well, because some of those will mirror, but you do have extra veins because they're lower in pressure. You do need some extra vessels to return back. Thank you for watching.